And your local election headquarters with an update on a controversial ballot measure in Massachusetts. Question 1 would limit the number of patients assigned to hospital nurses at one time. The Massachusetts Nurses Association has come out in support of the measure, while the hospital industry has fought against it. Tonight, Governor Charlie Baker weighs in. Eyewitness News reporter Caroline Goggin tells us how he'll vote on question 1. Caroline?
Well, Shannon, a UMass Lowell Boston Globe poll of 791 registered voters was released today. It shows that 51% of likely voters are opposed to question 1, 43% are in support of it, and the remaining 6% are undecided. Today, Governor Charlie Baker said he's siding with the majority. He will vote no on question 1 on November 6th.
Patient limits mean more time with your nurse.
Question number 1. It's shaping up to be the most controversial ballot measure in Massachusetts this election season.
It gives a vote to people and puts them in control of health care.
The proposed law would limit how many patients could be assigned to each registered nurse in Massachusetts hospitals and healthcare facilities. For example, in units with medical and surgical patients, 4 patients would be assigned to 1 nurse. Today, Massachusetts Governor Charlie Baker came out against the measure.
And based on the results of that report, I'm going to vote no on question 1.
The governor is referring to this report from the state's Health Policy Commission. He says it raised several issues he wasn't aware of, adding that he believes it could put the operational futures of some hospitals and nursing homes in jeopardy. The study estimates if question 1 were passed, hospitals in Massachusetts would have to hire up to 3,100 additional full-time nurses. Analysis shows it could also mean hundreds of millions of dollars in new healthcare costs every year.
The hospitals have been screaming from the hilltops of what this is going to cost, what this is going to do, and frankly also what it's not going to do. It's not going to increase quality patient care.
But the Massachusetts Nurses Association, which supports the measure, says setting nurse-to-patient ratios will improve care and safety.
The general public knows that the nurses have their backs, and I think they want to be with them because they know that they're running around with their head cut off in a lot of these institutions trying to do the very best they can.
And the group behind question 1 responded to Governor Charlie Baker tonight saying, quote, "It is incredibly disappointing but not surprising to see Governor Baker make a decision to oppose question 1 based on a flawed one-sided report by the Health Policy Commission. Hospital executives have been consolidating power and profits for years under the watchful eye of the Baker administration and the HPC. Now, Governor Baker's opponent, Democrat Jay Gonzalez, he supports question 1. If this measure does pass, it will go into effect on January 1st of next year. And if you live in Massachusetts and you still need to register to vote, you have until October 17th to do so. I'm Caroline Goggin, Eyewitness News.